65s. Kyle Hoath is the president here in WA of the AMA. He joins us now. G'day, Kyle. Good to talk to you.
Yeah, Simon, how are you?
I'm well, thanks. The Australian newspaper are estimating today this could be 40 to 90,000 Australians, which is 4 to 9,000 West Aussies, Kyle, on the 10% rule. What are you hearing?
Oh, we're hearing this could be more like affecting upwards of 1 million pensioners. Like, this is a significant change that is going to wreak havoc, I think, with our health system.
Yeah. So, Kyle, it's to do with standardising what's available for over 65s, isn't it? Removing this rebate for certain people.
Yeah, so it's about removing the rebate, particularly for that sort of age-based tiers that were introduced a couple of decades or a decade and a bit ago now. But what that means is, private health insurance will get more expensive for people over the age of 65 and over the age of 70. And the government has very clearly said that this will save them money that they can spend on other things. But that just means that we'll have either older Australians cancelling their health insurance and needing to go to the public hospital for their hip replacements or cancer treatments, as one of your callers mentioned, or it'll mean that they're more out of pocket each year, whether or not that's just because they've got to pay the difference or because their health insurer then bumps up the price further. So it's just it's a bit of a lose-lose. I think looks quite short-sighted, honestly, and the AMA is really surprised that the government has backed this in when we don't think it'll result in a saving. It just kind of shifts the problem somewhere else, and pretty unfair on our older Australians.
Yeah, who've often, paid taxes. It's obvious, paid taxes and paid health insurance premiums most of their life. Kyle, so it's being, to be clear, it was an age, for some people it was based on their age. Is it going to a more standardised, means-tested kind of threshold system, is it?
Correct, yes. It'll be the same regardless of your age and based on your income. Mm-hmm. And pension status and things like that. Not there is at the moment a rebate once you hit a certain age, so that is how it happens already. But then if you're over 65 or over 70, there's a rebate that older Australians get back for keeping their private health insurance. So there's an incentive for them to keep their private health insurance, which is important because our health sector is very much a delicate balance of the public and private sector. If we lose that balance and we have a number of Australians choosing not to continue their private health insurance because the rebate disappears, then that just means longer waits in the public sector, and particularly in those older Australians. Things like I mentioned, hip replacements, heart problems, cancer, a lot of things that we don't see more frequently until later in life are going to end up having to wait longer in the public sector. So it's really, it feels like just shifting the problem somewhere, sort of robbing Peter to pay Paul kind of thing. Not a huge fan.
Kyle, what are the AMA asking for? Are you asking this to be reconsidered and potentially wound back?
Yeah, we're asking for them to reconsider this and to get some independent analysis around what the actual impacts are on both the health system and whether or not it does create actual savings for the government, as they are saying, because again, we just think it's shifting it somewhere else.
Yeah.
Because we really want to know what is this? What is the impact on both the hospital viability if this happens, and then the demand that'll get shifted to the public sector. So we want them to wind this back, to do some independent analysis and to actually show what the impact will be. Listeners,
are you affected by this? Are you affected by these changes? Love to hear from you today. 133 882. Kyle and the AMA are saying it could be up to 1 million people Australia-wide. Hey, Kyle, just a topic without notice, if that's okay. I do notice that St John of God Mount Lawley is about to go public and about to open up, so those beds will become available. I guess we're all okay with that, aren't we?
Yeah, that's it's been a relatively smooth transition as far as these things go. A large part of the hospital has already been operated by the Department of Health this winter, and that has been relatively successful. So yeah, we're sort of in that final little stage now of it finally changing hands.
Yep. And the other one from me is, on occasion, to try and do the righty, I go to the urgent care centres around the place if I've got an issue and it's a weekend. I went to one at Midland the other day and there was no doctor. There's no doctor at all, and they closed down, which I thought that was the point of urgent care and of these St John's centres. Have you heard that sometimes they're understaffed doctor-wise?
Yeah, no, we have, and it's one of those really disappointing things that sort of the model doesn't work if it isn't properly funded or supported. And whilst there is some good data around what the urgent care is presenting to ED, there's just as much of these scenarios where they're either not assessed because there's not a doctor there, or not properly assessed, and then finding themselves in ED later and sicker. So look, really disappointing. A good idea in principle, but it doesn't work if it's not properly supported.
This is the Midland one, because my little one goes to school out there, so it was the closest one. And it was, there was no doctor, and they closed at 2:00 in the afternoon. Kyle, one more from me, if I may. And again, this comes from off the top of the head. Peptides. The use of peptides in our community seems to be more prevalent, centred around gyms, health, younger people. What are your thoughts on peptides?
Yeah, I mean, unfortunately, like with a lot of these things, it's the danger of not knowing what you're actually putting in your body, whether it's an injectable peptide, and as part of sort of anti-aging trend. It really, incredibly dangerous when we get to this point of not knowing what you're doing, what it might be interacting with in terms of your other medications, in terms of your overall health. The risks of knowing what's actually in some of these peptides are just a little terrifying, if I'm honest. Particularly because the large majority of this is all occurring in the black market through bad actors, effectively, who are not trying to do the right thing by you, but are trying to make money. So I'd be very, very, very cautious. I'd strongly recommend you don't and discuss these things with your doctor if there's something that you need assistance with, rather than turning to peptides.
It's definitely a thing. And I don't think I've ever asked you this before, Kyle. How's your health? How are you going?
Oh, thanks, Simon. Pretty good. Stressed, but, I like a good bit of stress. I'm feeling a little bit of the tickle of the colds that seem to be going around at the moment. But no, how about you?
Yeah, a bit of a sore back. Had an ear infection, got rid of that. But, we every day's a good day, Kyle. It's, coming into spring, you start to feel better as soon as the vitamin D comes out, don't you?
Dangerous, and one of those times that I remind myself how lucky we are to live in Western Australia when we get this amazing sort of spring and autumn weather. So yeah, definitely every day is a good day that we're still here.
Yeah, for sure. Kyle, always enjoy our chats. Thanks for making time for us today. I appreciate it.
Anytime, Simon. Take care.
Thank you. Kyle Hoath, who's in good health at the moment.